The lava crown is a beautiful crown, and we don't get much breakage on a lava crown. But more recently, they took it to the next level, and they took the zirconia. Originally, the zirconia was like refrigerator color. It was a white color, so you couldn't make the whole tooth out of it because it didn't look right. Now they've made zirconia where you can get it in all colors. They're starting to make it more translucent. So now you can make a full crown on back teeth out of all zirconia. So it's like three or four times as strong as any type of crown that's two materials baked to each other. So when I'm putting a crown on back teeth, I prefer to do a zirconia, all zirconia crown, because I feel like the patient's not going to have it replaced because of breakage. You know, as long as they take care of their teeth, they floss, and they don't get decay underneath, they're going to have that crown for their lifetime. They're now making the zirconia more translucent. They have an anterior or front tooth zirconia that's not as strong as the back tooth zirconia, but it's still twice as strong as the other type of crowns. And it's very, very aesthetic looking. So we can do a full mouth now out of all zirconia restorations that patient's not going to have to worry about it breaking. You know, basically those type of crowns, if they're in your mouth for a year or two and you don't have any breakage, they're never going to break. This is a great advance in dental materials. As far as bridges, you know, a bridge is to replace a missing tooth, and the state of the art now is, instead of a bridge, is to have an implant placed. So you can have an individual tooth instead of a bridge where you can't floss in between the teeth. You can have an individual tooth there. So if the two teeth on either side of the bridge were natural, you don't have to grind those teeth down for a bridge, and you can floss in between the teeth. If you had a bridge previously, you know, and that bridge needs to be replaced, you can have an implant placed where the missing tooth is, and you can have 3 individual teeth placed there. Or sometimes I still have patients that they said, my bridge was in there for 30 years, I have to have it replaced. It was fine. If I need a new bridge, I'm happy with a new bridge. So we can do a new bridge out of the newer materials. We know it's not going to break, and it's going to last them for the rest of their life. So they can go that way without an implant. You know, with implants and with new dental materials, we've got the best of both worlds now. We can offer our patients, you know, great treatments, great options, and it's up to them to decide what they want, which way they would like to proceed.